Hello everyone. This is lecture 1 of course PE 645, Artificial Intelligence and Radiomics. In this lecture, we will understand the meaning of artificial intelligence and the inner sub-branches of it, such as machine learning, neural networks, and deep learning, and then go through the different modalities, such as CT and MRI, and understand the meaning and usage behind each of them. And by the end of this lecture, we will understand the workflow of any AI system that can be used in your projects. Artificial intelligence is a big umbrella that refers to a range of systems that can make accurate conclusions from different datasets using different computational techniques. And artificial intelligence can be named on any system or framework or platform that can mimic the behavior of the human. Machine learning is a sub-branch of artificial intelligence. And in machine learning, you are going to train algorithms to learn and make predictions based on the given dataset. So if you have a certain dataset, whether it's tabular data, audio, video, or images, and you are building a system that can learn from the given dataset to learn to capture different patterns from it, then this can be called machine learning. Neural networks is a sub-branch of machine learning, and in it, you are going to build models which are inspired by the human brain. And the design of neural networks is done by cascading a set of layers, and each layer consists of different neurons or nodes. And in neural networks, you are trying to mimic the nervous system of the human. So in the human brain, there is a nervous system that consists of different neurons, and each neuron can be connected to different other neurons or intermediate neurons. So in neural networks, you are going to mimic that by building certain layers, and each neuron is connecting to the following set of neurons in the following layer until you reach a decision by the end. Deep learning is a sub-branch of neural networks, and in it, you are doing the same, but in an advanced form. So instead of just using 3 or 4 layers, you are building complex models, for example, 100 or 200 layers. And by doing that, you are going to capture complex patterns in large datasets. So the big umbrella is artificial intelligence, and it captures all of the frameworks or models or architectures that can mimic the human behavior or the intelligence of the human behavior. And if you have a certain dataset, then you are dealing with machine learning. And if you are going to follow or mimic the nervous system of the human, then you are building neural networks. And if you are going to build complex system that consists of large number of layers, then you are going to deal with deep learning. So now you understand the meaning of artificial intelligence. What about radiomics? As the course name is called Artificial Intelligence and Radiomics. So before understanding the meaning of the word or keyword radiomics, let's think about these two images. It's a scan of a human, and the arrows points to some regions. For example, this arrow points to this region, and here, here, and here, and the same for the other image, like that. And I'm asking you about your insights. You may say it's a darker region than the whole other region, so there is a difference in the intensity or the texture. Maybe you can say, I found that image or similar images on the internet or any research paper, and I found that when you are targeting or pointing to a darker region, then this can be a tumor or a cancer. So from that, you need something that can capture the different features from these modalities or these images. And here comes radiomics. So radiomics represents a novel concept in the field of radiology, and it consists of two words, radio and omics. And radio here refers to the medical imaging, and omics here refers to the discipline. For example, genomics, then you are dealing with the field of genomes, and so radiomics. So you are dealing with medical images such as CT and MRI, and in that field, you need to extract meaningful features from these images, such as what we did here. Maybe you can compare between a tumor cell or an organ with a tumor or a normal organ by simply comparing between the texture intensity, the shape, the size, the volume of it, and so on. So simply, the title of the course is Artificial Intelligence and Radiomics. From that, we can understand that we need by the end of this course to build a framework or a system that depends on whether you are dealing with machine learning, deep learning, or neural networks, but you need a system that's able to differentiate between the different tumor types or the grade of tumor using the extracted features from the medical images. So simply, you have some medical images, which we call a data set, and you extract some sort of features that we are going to learn throughout this course. And from these features, you are going to provide it to a machine learning or an AI system, and that system will be able, after learning, to discriminate between the grading of the tumor types, and so on. And radiomics deals with different organs, such as lung, heart, liver, kidney, and the prostate. As we mentioned, we are dealing with medical images. So, in the field of radiomics, there are many medical image modalities, such as CT, MRI, PET, ultrasound, X-ray, and different hybrid modalities. And each modality has its own specific organs. For example, the CT can be used with chest, kidney, lungs, and brain. MRI, for example, can be used with liver or cardiovascular systems. And each modality has its own specific usages, cost, and protocols. So let's begin with X-ray. So in X-ray, the machine is going to use electromagnetic radiation, and it's suitable for imaging bones or any dense tissues. It's quick and inexpensive, but it has limited details on soft tissues. So if you have dense tissues or bones and you need to make an initial diagnosis about some sort of disease, then you can use X-ray. X-ray is commonly used with diagnosing fractures, pneumonia, and dental issues. As you see in these two images, if there is some sort of fracture in the bone, for example here, the X-ray image will display it as a fracture like that, depending on the type of fracture or the size of it. If you combine X-ray with computer technology, then you are going to deal with computed tomography or CT. And the benefit of CT is that it can deal with soft tissues and blood vessels. So you can use CT to detect a tumor, internal injuries, or assessing blood flow. And if you need high resolution image of soft tissues, then you can rely on magnetic fields and radio waves. And in that case, you can deal with magnetic resonance imaging or MRI. Compared to X-ray and CT, MRI can take longer than them. And because it deals with magnetic fields, it can be difficult to deal with patients with certain metallic implants. MRI is excellent for imaging brain, spinal cord, joints, soft tissues like muscles and ligaments. And in MRI, there is no exposure to ionizing radiation, as we are going to see with the PET scan. So, from these three modalities, X-ray deals with bones and hard tissues. If you combine that with technology or a computer technology, then you are dealing with CT and it can capture soft tissues. And if you need high resolution soft tissues, then you can deal with MRI. As we mentioned, there is some conflicts or difficulties to deal with patients with certain metallic implants because MRI relies on magnetic fields. And this video shows the difficulty behind it.
We're just walking into the MRI
As you see,
now.
there is a nail which is attractive to the machine, which is working and relies on the magnetic field.
As I'm getting closer, and we're starting to reach the head coil here. We're starting to see some pull at about 4 feet away from the magnet.
As you see here,
3 feet from the magnet, 2 feet from the magnet, and that's pretty much as strong as it's going to get right at the edge of the bore there. We're just walking into the MRI room now.
the fourth modality is called ultrasound. And ultrasound uses high-frequency sound waves, and it's real-time imaging. It's safe compared to other modalities, non-invasive, and no ionizing radiation. And it's helpful for imaging developing fetuses during pregnancy. But it has limited penetration depth and resolution in obese patients or areas with gases. And this is a scan of fetus of the week 22 As you see here, it's a real-time imaging of the fetus. The next modality is called PET, or positron emission tomography, and it involves the injection of radioactive tracer, and simply in it, the patient is injected with a tracer, then the patient waits for a certain time until it flows with the blood, and the patient is subjected to the scan, where the scan measures the metabolic activity in the tissues, and it can be used to detect cancer, heart disease, or any brain disorder. And this animation is about the PET scan and how it works. The next modality is called SPECT, or single photon emission computed tomography, and it's similar to PET, but it uses different tracers, and it measures the gamma radiation emitted by the tracer, and it's commonly used in nuclear medicine studies, and it's expensive, and it can provide information about the organ function and the blood flow. And this is a video of how SPECT CT scan works.
A SPECT scan is used to assess the function of tissues or organs in your body to identify disease. A CT scan provides your doctor with high-resolution images of structures in your body. In other words, SPECT assesses physiology and a CT assesses anatomy. Today, generally a SPECT CT scan is performed where the images from the two different types of scans are captured during one session using a hybrid scanner, and the images are combined. Each piece of information is important, but where combined, they are even more useful. A SPECT CT scan is undertaken in two parts: the administration of the tracer and then the scan that shows how the tracer behaves in your body. A nuclear medicine is generally administered through an intravenous injection, but can also be inhaled, swallowed, or injected in the skin. What study you have will decide how the tracer is administered and whether it is done lying down on the scanner or elsewhere in a chair. The injected nuclear medicine gets taken up and concentrates in the part of the body under investigation. Some diseases cause increased function, some cause decreased function, and some cause changes in function, all of which can be imaged on the scanner. Virtually all organs and tissues can be investigated using nuclear medicine. The most common procedures include the bone to detect and assess changes in bone function associated with cancer, trauma, and metabolic changes, and many other diseases. The function of the heart can be evaluated by examining blood moving through the heart or imaging the blood flow and movement of the heart muscle itself to diagnose a variety of diseases. Nuclear medicine can also be used to study lung, kidney, thyroid, brain, and many other organs and tissues in the body, and importantly, to investigate cancer. Because some body functions are fast and some are slower, the time between administration of the tracer and the scan can vary from minutes to hours. Some people may even be required to come back on multiple days. For diagnostic scans, the nuclear medicine is radioactive and emits gamma rays that can be detected by the scanner. The SPECT CT machine has two gamma cameras that detect gamma rays and produces a map of how the tracer is behaving. These detectors rotate around the body, taking images every few degrees, allowing images to be reconstructed in 3 dimensions. The SPECT scan can take 10 to 20 minutes, and then the CT scan takes less than a minute. The scan collects important information that is processed by a computer. This information is then carefully reviewed by a specialist nuclear medicine physician to produce a report for your doctor. Your doctor will use the information to help determine how to manage your specific health condition or assess the response to current management.
The last modality is fluoroscopy, and it's a real-time X-ray imaging, and it's useful for observing moving structures, and the drawback of it is it has continuous radiation exposure, and it's necessary to precaution to minimize the radiation dose to patients and the staff. So if a child swallowed a key or a coin and the doctor need to determine the position of that coin or key, then fluoroscopy can be used. This is another video of the fluoroscopy and how it works.
This animation is brought to you by the Smart Image Base, a subscription website where you can download thousands of medical images and videos to use in lectures, courses, presentations, professional training, and more. For more information, click on the link in the description. X-ray images are like photos of the inside of your body. But X-ray videos can be made as well. They're made during a procedure called fluoroscopy. One reason your doctor may give you a fluoroscopy exam is to find out if you have certain diseases, such as problems in your digestive tract. A second reason your doctor may use fluoroscopy is to perform a procedure, such as a spinal tap. A third reason is to find, locate, and identify a foreign object in your body. There are several types of fluoroscopy machines. A fluoroscope may be fixed in place in a special shielded room. Or it may be a portable machine that can be moved to you if needed. A computed tomography or CT scan machine can also be used as a fluoroscope to see slices through the body as the images are taken. Before a fluoroscopy procedure, you may be given a contrast substance. It may be in a drink, a paste, a pill, or an injection. During the procedure, you will lie or stand on an X-ray table. An X-ray tube will be aimed at the body part to be examined. Then, an X-ray beam will pass through a part of the fluoroscope that shapes the beam to just the area of your body being studied. This helps reduce your exposure to X-rays. After the beam passes through your body, it will be converted into a video seen on a monitor screen. If you receive a contrast substance, it will make the structures stand out better on the screen.
Now we understand the meaning and usage of the different modalities such as X-ray, CT, MRI, PET, SPECT, ultrasound, and fluoroscopy. So let's try to solve this example. We have 6 cases and we need to determine which modality can be used in that case. So for the bone fracture, which is here, X-ray can be used because it's useful with bones and hard tissues. For strokes 1, which is here, and strokes 2, which is here, we can determine that in strokes 1, it's a high resolution, while in 2, it's a low resolution. And both of them are soft tissues, so we can deal with CT and MRI. MRI deals with high resolution, so strokes 1 can be here, while CT can be used in that situation. If you need to extract object, which is here, we can use fluoroscopy. And if you need to check the baby gender or age, we can use the ultrasound. And in cancer cases, which is here, we can determine that the patient got a radioactive tracer or a tracer substance, and in that case, we can say PET and SPECT can be used, depending on the tumor, organ, and the type of injected tracer to the human. And this is the final answer. After getting some information about the different modalities that can be used, let's assume we have a dataset for medical images, and we need to start to build a workflow with artificial intelligence to teach it and train it to be able to discriminate between different grades of a tumor, or discriminate, for example, between a benign tumor or a malignant tumor. So in this course, we will follow 6 steps to build a workflow with artificial intelligence with the help of radiomics features. You can find in different materials or research studies that they may combine two of these steps in one step, or they can introduce an extra step, but the standard workflow can be divided or split into 6 steps. The first step is acquiring radiological images and applying annotation or segmentation on the region of interest. So simply, we have a medical images. Let's assume we have MRI or CT. Then we need to annotate these images. So instead of dealing with the whole image right here, we need to determine which organ or which region that we need to deal with. So the medical staff will help us annotate that part, for example, like here. So we can only focus on that region, or let the system or the AI system focus only on that region. For example, if you are dealing with kidney tumor, then you are going to annotate or segment only the kidneys from the different images. The benefit behind that is that by annotating that region only, or the organ or the target organ, it will not be affected by the different organs or any artifacts in the images. The second step is to extract radiomics features from ROIs. And ROIs here are regions of interest. For example, in the kidney tumor, the ROI is the kidney. And here we will deal with different mechanisms and algorithms to extract numerical features and values from these ROIs. So in this course, we will deal with first order features, second order features, and from these features, we can train the model, making it able to discriminate between benign or malignant tumors. The next step is to clean and pre-process these features. One of the techniques is to pick the most significant features from the group of features. So instead of dealing with 100 features, for example, then we can only deal with 90, 80, or even 50. So we are going to inject a pre-processing step to pick the most important features, which is relevant to the problem and cannot introduce some sort of bias, and will also help to reduce the time or the training time. After pre-processing and making the dataset ready to be used, then we are going to develop the model, and the model will learn from the different patterns from the given features. The model needs to be trained, validated, and tested, and to determine that the model is efficient, we need to do two things. The first is to report the performance metrics, and the higher the performance, the better the model. For example, a model with 97 accuracy is better than 50 accuracy. And the second thing is to explain why that model produced that decision. We can deal with explainability frameworks such as SHAP and LIME frameworks, and to determine by the end of our workflow that the built system is capable of discriminating between the tumor types or the grades, and also can be generalized and used in real-world application. Then don't forget these two items: report high performance metrics and explain why this model decided to make that record to be a tumor or a normal cell or a normal organ. Let's go through each step, but first let's look at these two images, and I will ask you to detect a defected apple. You may say this apple may be defected, this one may be defected, this is not an apple, and so on. So by determining that one of these apples is defected, for example, that one, then what you are doing here is annotating the defected ones. This is a similar process when you are asked or you are asking a medical staff to manually segment the region of interest. So in kidney tumor, then you may ask the medical staff or the doctor to annotate only the kidneys and also annotate the tumor regions. There is another way, it's called automatic segmentation. And in automatic segmentation, you are getting the manually segmented regions and introducing it to a model, and that model will learn by the end to segment any other images automatically. For example, let's assume this framework. We have a CT scan for a liver, and we need to segment two things: the liver and the tumor. So the authors of this research study built two models. The first is to learn how to segment the whole image to get only the segmentation map of the liver, and then introduced the segmentation map of the liver to another model to detect only the tumor. To build these models, you need data. So a crucial step, as we mentioned, is to get manually segmented ROIs. And an optional step to make your system automatic is to apply automatic segmentation. By building that automatic segmentation model by the end of your workflow, then you may not ask again a medical staff or a doctor to re-annotate or manually segment again any later images. There are many segmentation techniques, and there's a taxonomy of the different segmentation techniques, including classical approaches and deep learning approaches. And if you remember, the word deep learning means that you are building complex model that consists of large number of layers with neurons that's capable of doing a complex task. And this task here is segmentation. The difference between supervised and unsupervised is simply in supervised learning is that you are applying or introducing the images and outputs to the model, and the model tries to map between the images to the masks or the maps. And in unsupervised learning, you are only giving the input images. And in that case, the system tries to make clusters or groups from the medical images or the input data. So simply, in supervised, you are giving input data or images and output masks. And in unsupervised, you are giving only the images. System here tries to learn the patterns to map from the input to the output or from the images to the masks. And system here tries to find the clusters or groups between the regions inside these images. Let's assume we make an automatic segmentation, or we segmented the data set in hand, for example, liver cancer, and we have the ROIs. What's the next step? As we mentioned from the workflow, we need to extract features. So first, look at this image, and I will ask you which one of these strawberries would you like to eat? You may say, this one is better than that one. The reason behind that is that you saw some mold or off smell, or it changes in the texture, or when you touched it, it became mushy or soft, and so on. Then you determine that this one isn't eatable. So what you did now is you extracted signs or features. That is the same what we need to do. We need to extract features for the tumors, whether they are benign or malignant, and normal cells or normal ROIs. So in extracting the radiomic features from the ROIs, you are going to quantifying various quantitative imaging features that characterize underlying tissue properties, capture within the segmented regions, which are the ROIs. There are many algorithms, including first order, second order, higher order features, and these features can capture the texture, shape, intensity, or spatial relationships of the tissues. And we are going to deal with these different techniques and understand how can we extract the features and store it to be applied to the next steps. The next step is to apply preprocessing, such as selecting the most promising features or the significant radiomic features. And this step is necessary to enhance the model interpretability, reduce overfitting, and improve predictive performance. There are many techniques for feature selection, including supervised and unsupervised ones. And in an upcoming lecture, we are going to deal with the different techniques of feature selection and understand the different subcategories such as filter, embedded, and dropper method. But simply here, you have all features, and by applying feature selection, you are going to ignore some features and emphasize the others, and the final features will look like that. So you take these features and apply it to your model. Now we have the most promising features, which are cleaned and preprocessed, and we need to apply an AI-based model. And in that case, you can apply machine learning, deep learning, or neural networks with the model you are going to use. But remember, at the end, you need to report high performance and explain your decisions. This is a framework from a research study. They applied preprocessing, made segmentation and improved that segmentation, got the ROI, extracted features, and then applied it to a model to get a final result. During training or teaching the system or the model to learn, we said we need to apply training, validation, and testing. The difference between them is simple. Training means that you are teaching the system. Testing means that after teaching the system, you are going to test it. For example, with students. Students learn throughout the course, and by the end of the course, they are tested. Training is the seen data, while testing is the unseen data. For example, you may provide for a student that 1 plus 1 equals 2, and for the testing, you may ask the student 2 plus 1 and ask the student about the result. So this is the seen data and this is the unseen data. What about validation? Simply, for some algorithms and techniques, they require a validation subset. So instead of providing the training subset to the model, you are again splitting the training subset into two sub-branches or into two subgroups, training and validation. And both of them together are used in the training phase. The model learns from the training, and after certain iterations or epochs, the model is validated, such as quizzes. After number of lectures, there is a quiz. So this can be called validation. Both of them are seen data, while in the testing are unseen data. The meaning of seen data is that the model sees them during the training process, while in the testing, the model doesn't see any of these records during the training phase. So simply, if you have a data set, you can split it into training and testing, or again, split the training into training and validation. This is the seen data, this is unseen data, this is used in the training process, and this is used in the testing phase. This subset teaches the model, and this subset validates after certain iterations or epochs that the model performs efficiently. There is a mechanism called cross-validation, and in cross-validation, it splits the data into training or the whole subset and the testing. Now ignore that subset and focus on that subset. During the training, it splits equal groups of records. Let's assume you are dealing with threefold. So in that case, we have three folds, and the data in each fold will be split into three subgroups. Two of these groups will be used for training and the third for validation. And in the second fold, the first and the third would be for training and the middle for validation. And for the third fold, you have the last two for training and the first for validation. So simply, if you have k-fold cross-validation, you are getting k-1 for training and 1 for validation. By completing the training, now you need to test the model. And here comes the testing data. As we mentioned, you need a higher performance model plus explainable model. Let's focus in a higher performance model. Here means that in the training and testing, they should be higher values and close to each other. For example, you can say I got a model with 99 in accuracy for training and 98 for testing. This can be considered as a good model. But if you got a model with 99 in training but 70 in testing, this is not a good model. And in that case, we call it overfitting, where the model learns efficiently, but in testing, it doesn't perform in an efficient manner. And if you got a model with 70 in accuracy for the training and 99 in the testing, then this is also not a good model. And in that case, it's called underfitting. It doesn't train well on the training subset, and randomly or luckily, it produces good prediction for the testing. So a higher performance model means that in the training and the testing, both should be close together and higher values. The last step is explainability. And here we need to explain why the model produced the decision to make it transparent and understandable. And this will build the trust and ensure accountability. For example, here in this study, they reported that the decision made because of that region, and here that region, and here that region. So when you build a system, you may go to a specialist after building your system and post a check to ensure that your system is performing well. So you are providing the decisions. Let's assume this tumor, and this is normal. The specialist will check each image, and if all of them are correct from their perspective, let's assume they are determining the tumor because of that region, and the normal regions are here, then your system is efficient. Because your system may produce high performance, for example, 98 for training and testing, but when you apply explainable AI, or you try to explain and make your model transparent, you may find that your model is learned the better by discriminating between, for example, benign and malignant, because there is some sort of artifact here or here. So your model learned or got the better that any image with an artifact here or a region here is a benign, and if it's here, it's malignant. While in real, that all of this region doesn't reflect that the image is benign or malignant, and the real decision should be made from the internal region. So, with that said, in this lecture, you understood the meaning of artificial intelligence, radiomics. You went through different modalities such as PET, SPECT, MRI, and ultrasound, and then you know the workflow of the AI pipeline, starting from acquiring the dataset and segmenting it, to explaining it, passing through preprocessing, building the model, training, validating, and testing. And we ensured that to make an efficient model, you need to report high performance and explain your decisions. And both of them should be correct.